Electronic cigarettes are back in the headlines in recent days. An FDA ban on Juul e-cigarettes is on hold as an appeals court reviews that decision. The FDA has long faced scrutiny over a lack of regulations for the multi-billion-dollar e-cig industry. Now those companies must prove that their products benefit public health, such as helping adults quit or reduce the habit and not creating a new generation of teens addicted to nicotine. Juul is being given more time to make its case. And while e-cigarettes may be less harmful than traditional smoking, health professionals continue to debate whether they should stay or go. Electronic cigarettes were first introduced in the U.S. in 2006, billed as a healthier option for traditional cigarette smokers. Dr. Shelley Schmidt with Spectrum Health says that's sort of true.
Even if the National Health Service is saying that e-cigarettes are 95% less harmful than cigarettes, that's much less harmful. But that's still tens of thousands of potential people who could be significantly affected in terms of having long-term lung injuries or even death.
In August of 2019, the CDC began collecting data on a growing number of lung injuries associated with vaping. In February of 2020, as the focus shifted to COVID-19, that reporting stopped. Dr. Schmidt tells me the lung injuries did not.
Recurrent bronchitis, colds that go to the chest, people just not able to shake a cold with long-term cough afterwards. Their oxygen levels are low, where they're so short of breath that it's hard for them to speak, to require either high levels of oxygen or sometimes ventilator support.
Not to mention the impacts of nicotine addiction, difficulty focusing, mood and anxiety disorders, and a weakened immune system.
The amounts of nicotine in these devices are way over what would be required to help somebody who is trying to transition off of traditional cigarettes. And now this is all just a game of addiction. It's how do we get as many kids addicted as fast as we can and make as much money as we can until the feds are onto us and do something about it.
Her suggestion? Limiting sales to adult-only facilities.
Age 21 to enter, 21 to buy, and to try to get these devices out of convenience stores, out of grocery stores, out of places where it's very easy for young people and kids to get a hold of them.
U of M researcher Dr. David Mendez says the benefits of e-cigs outweigh the risks. His latest edition of nicotine and tobacco research finds that vaping will lead to millions of people quitting traditional cigarettes over the next 80 years.
The issue is that if taking those products out of the market will harm a lot of people that cannot quit without them.
Another problem, he says, is not knowing exactly what you're vaping. He says that should be left to the FDA.
What is in there? What is the liquid that's in there? The construction of the device, the temperature at which they can heat the liquid and aerolize the components.
While Dr. Schmidt agrees there are some benefits to helping adults who already had smoking habits.
Your lungs are really only designed for clean air. Anything other than that is causing inflammation. The question is how much inflammation it's causing and whether or not you're noticing it from a symptom standpoint.
Now, the recent FDA ban originally meant Juul could no longer market, sell, or ship products. The company can now resume business as usual while that ban is under review.